Welcome to Investing in Impact. This season of the podcast is happening on the sidelines of the International Development Innovation Alliance IDIA Summit being held here in Nairobi. Today, we are going to be talking about future horizons. How can we imagine a more robust health ecosystem in Africa in the current context?
It's 2035, and Africa's systems are thriving without foreign aid. What's the one thing that made that possible?
You know, in the keynote panel today, they talked a lot about striving to develop Africa for Africa by Africans, right? And that resonated very well with me because I think a lot of times we depend solely on aid. And at the end of the day, when we are left to sustain whatever that intervention is, it becomes a problem. For us to get to the point where we don't need aid anymore, we have to have an ownership mindset, which will help us to really continue to sustain those things in a meaningful way.
So thinking forward to 2035 and how Africa's innovation ecosystems are thriving, I think it's going to be locally driven, and it's going to be because of the strength and the capacity of the institutional partners on the continent. I think foreign development partners may still be there as partners, but they won't be driving it. It'll be driven locally. The agenda will be set locally, the capital will be coming locally, and the ideas will be coming locally. And I think our role as development agencies will be a very different one, where it'll be about collaborating, exchanging ideas, bringing innovations from Africa to the rest of the world, and doing more sharing and learning from one another.
As we look into this discussion, I would like us to start, first of all, with a round of introductions. So we'll start with you, Professor.
My name is Mirkuzie Woldie. I have been trained as a medical doctor and I've specialized in health policy and systems. I've been serving at Gina University, Ethiopia, as a professor of health policy and systems for about a decade and a half. Then moved to Addis Ababa, where I work in the Float project of Harvard University, which is a project mainly working in evidence-informed decision-making and healthcare financing. I am the Deputy Director for Evidence-Informed Decision-Making in that project. And in my role, I also support the Ministry of Health as a Senior Advisor in Health Policy and Systems Research. That's me.
Thank you, Professor. Over to you, Gina.
Thank you so much. I'm Gina Lagomarsino. I'm the CEO of Results for Development. I spent the first decade of my career working on building stronger health system in the United States, my home country. And then about 20 or so years ago, I pivoted and started working globally. I was a co-founder of Results for Development, and I'm now our CEO. And our mission at Results for Development is to support local change agents in countries around the world who are building strong systems for health, education, and nutrition.
Thank you, Gina. Over to you, Thomas.
Hi, good morning. My name is Thomas Davin. I'm the Global Innovation Director for UNICEF in the Office of Innovation. The Office of Innovation is focused on acceleration of impact for children, really at global level. Part of that acceleration is really leveraging what innovations are most transformational for children's lives, whether it is around nutrition, education, healthcare, water sanitation, mental health, etc. So part of the work of my team is where are these innovations happening, which are the actors leading these innovations, and how can we help other actors understand the power, the transformational power of that, and how can we then help them adapt and adopt them to those contexts.
Thank you very much, Thomas. So on today's episode, we're looking ahead to a future where African health innovation isn't defined by what donors will fund. What would it take to build a truly self-determined, resilient health ecosystem across the continent? And to kick off this discussion, I'd like to invite you, Gina. And part of what I want you to do is just talk about the big picture in terms of health systems, vulnerability, and resilience. And so my question for you is around resilient health systems. how does this concept of One Health actually build the strength of the ecosystem from the ground up, making the health system less likely to break when the next big crisis comes up?
Well, thanks so much, Moses. I think it's important to start with the context of what's going on in the world right now. We've had major global donors pull out or significantly shift the way they are working with countries around the world. And that's been challenging for many, many institutions that work globally and for ministries of health globally. But I think it also presents an amazing challenge, amazing opportunity for us right now to really rethink the way health systems are working and the way partners support those health systems and how innovators can actually integrate into those systems. I think a challenge with the way the global development space has worked in the past is it has encouraged fragmentation. It's been very focused on particular projects, on particular interventions, perhaps important interventions like vaccinating children or making sure women can safely deliver, crucially important. But because it has looked at each of those in isolation, it hasn't necessarily supported health systems to build the infrastructure and the architecture to be able to be resilient and respond to unexpected shocks like things that are happening related to climate right now, floods, pandemics, et cetera. And so I think right now offers an opportunity. I think you've got country leaders who are stepping up and saying that they really want to take charge of their systems, finance their own systems, determine their own priorities. And as they're doing that, they are really thinking about how to create strong integrated systems that have, financing for clear packages of services, that have very clear delivery systems, primary healthcare delivery systems, and other layers of the system that can respond to multiple challenges. And I think they're also working to create, for example, strong data platforms that enable them to see what's happening in the system and then make decisions real time based on that data. So it's a huge opportunity right now, I think, both for leaders in countries, but also the innovators that have the opportunity to engage and support those leaders to build the system of the future that will be an integrated system that is capable of dealing with this challenging time in our world where we have so many interdependent crises happening, climate, migration, changing disease patterns. We need to build systems for that kind of a world rather than for a fragmented world that focuses on separate diseases and separate issues.
Thank you. Very well said. Currently, we are having disease patterns changing in an unprecedented way, but the context has also changed, but we don't have to see it as a crisis. The funding context has changed, but it's not necessarily a crisis. It's actually also an opportunity for integration.
Absolutely.
To you, Professor, how can tools like AI allow African health ministries to set their own agenda? And, picking on what Gina was talking about, moving from reacting to external priorities to proactively solving their most pressing challenges.
Yeah. So in terms of use of AI and digital health technologies, I think the most important opportunity is, ministers of health at all levels do have like a huge dose of data which they don't usually, give attention to. But given this technology in place, it is an opportunity, I would say, to really use it to inform decision-making, forecasting, planning, and so on. So to do that, there should be like a move from the local governments to really set up the infrastructure, develop the human resource needed to really use that data to forecast problems, ensure that the evidence that comes out of the exercise is used at all levels of the health system, not just to develop like big strategic plans, but also even annual operational plans need to be properly evidence informed And that really would help them to make sure that the health system is prepared for whatever's come, not only in terms of managing this crisis in relation to financing, but also making sure that relevant interventions are planned and implemented, monitored, and implemented for impact in a way to really handle health problems from their roots in the community.
Thank you. So in this new context, what I hear you saying is that technologies like AI can lead us to a situation where we're more efficient in the way that we use resources, and then that we rely on data to make those sort of decisions. Now, over to you, Thomas. You talked about your goal as accelerating impact for children. And I want you to bring in the question of technology here and more on a practical level. Sometimes when we talk about AI, we're talking here, but you see a lot of innovation from all over the world. I'd like you to sort of speak beyond piloting to making technology an indispensable part of African health systems. Could you speak a bit to that?
Yes, and there's always two lenses on AI, right? Is it a magic bullet, or is it just a bullet? And I think we need to be cognizant of the two faces of that coin. Because they're real, but I think that we are excited in a number of ways that AI can definitely be a transformational tool. If I think of access to water, for instance, we are using AI to use geosatellite imagery. We overlay that with GIS mapping of water sources and new technology that have been invented. We're able to find water sources at a depth of 500 meters. We're using that in Ethiopia, in northern Kenya, in Somalia, and we're finding water at depth we've never found before. So that's a way, and if we can demonstrate the ability for us to do that sustainably, we can then get private sector investment to help us drill, because depths, when you build a well at that depth, it's quite a cost. But we can recoup. We know that the populations that are accessing water in those countries are actually paying for water at often up to 25% of their monthly income. So there is the revenue mechanism that is possible there in some of those contexts. So that's one example. But we also know that when we use AI in health, for instance, and the doctor was mentioning Ethiopia, but we're working with a number of countries in the continent looking at how do we use AI to understand the population census and overlay that with vaccination data sets to understand where are potentially children that are not accessing vaccinations at all. And why is that we are vaccinating X number of thousands of children in that region when they should be more, or maybe they should be less. So we understand population movement, and AI enables us to make connections and gives us flags on, you're not vaccinating the number of children that are supposed to be in that region. Or, again, connecting with education systems. How come you are vaccinating, I'm giving an example, 1 million children under 5 in that region, but you seem to have 2 million children of 6 to 7 years old accessing school, so it means you're missing quite a lot of children. How is that? So AI should be a tool where you're really enabling the system to help you understand, as a system, some elements of the system don't make sense, for then people like the professor to say, okay, we have a data gap here, or actually the system does make sense. It's the data that is actually not working well. And as we do all of this, I think we also need to understand, again, the potential for AI to be dangerous. So I give you one example. We know that we've used, in Poland, there was a study that looked at doctors using X-rays and using AI to give a first outlook of the quality of an X-ray. So they were giving a first report, and doctors in Poland were using that. And after 3 months, we realized that the same doctors who were doctors before, who were specialized in using those X-rays, were less able than before to actually give an outlook of what these X-rays meant, because they had been relying more and more on AI to just tell that story. And so they faced cognitive decline. So we just need to always be mindful of the potential for AI to be an augmentation to the capabilities that we have, and always query, are we reaching that sweet spot where it's augmenting and not, causing cognitive decline, or, us, and for students or in schools as well, to become lazy, and for our brain to suddenly lose neuroplasticity. So we just need to just be mindful of the potential both ways.
Thank you, Thomas. That's really, really interesting. When people talk about the harms of AI, I think they think about AI taking over the world, but you're giving us like a more practical kind of harm, that you forget to do the things you were actually trained to do because of relying on technology. So part of what I want us to do, as I said earlier, this conversation is about reimagining the future. And I would like to ask each of you, what are your big bets? What do you see as pivotal interventions, whether for you, Professor, at the policy level, or even at the practical level in the Ministry of Health? So for each of you, if you could just maybe share some of your big bets that you think will really determine how health systems look like in the future.
Well, from the experience in Ethiopia, I would say a very important move, given the changing context in the current world, would be to really do more of primary health care, more of community-based interventions, more of engagement of the communities themselves. Why I'm saying that is, we have seen that there are resources in the community. What we need as health system managers, researchers, professionals serving in health facilities, what we need to do is to really know when and how to engage communities. This would ensure that, one, resources are mobilized from a sustainable source, which is a community, and two, when disasters happen, resilience is easily achieved, because these are the people who, detect the problems firsthand because they experience it, then support each other. They have the culture of, in my country, people have the culture of supporting each other, particularly in times of crisis. So it is better to really tap into that, make sure that we really engage the community in everything we do, in the planning process, in setting up priorities. Then, when things change, when disasters come in, and it won't be very, difficult for the health system or managers, the health professionals in the primary health care units to get support from the community in terms of, finding cases, referring cases, helping out neighbors, and so on. So I would say, rather than relying on outside support, the community should be supported to be self-sufficient. And then governments on their part should really, go for investing more on health, because because of the official development aid that has been there, governments have been more of reluctant to really commit resources. Now we are seeing some change, and that has to be strengthened. In Ethiopia, for example, they have recently created a fund which they call Disaster Preparedness Fund. So that's like earmarked for disaster issues. And disaster, as you know, includes health, because disasters, when they hit, they hit hard on the health system. So the health system would have its share from that disaster fund. So a move such as this one are very important from the government side, and at the same time, the communities should be really, equipped with the ability to really respond to challenges in their own, in addition to the government's effort.
Thank you. And Gina, for you sitting at a global level, working across countries, and over many years, what a strategic advice would you offer to governments and also funders based on your experience and also the situation as it unfolds?
Thank you. Well, first, I absolutely agree with Professor Mirkuzie about the need for strong government domestic financing systems and strong community-focused delivery systems. I think really, really focusing on improving those aspects of the system is crucial. But I know there are many folks that listen to this podcast that are innovators trying to figure out how do we engage with that. And I think there's both a potential for a lot of opportunity right now for different innovations to come in. But I think those innovators really need to think about how they're going to fit into that system. And governments need to figure out how they are going to integrate those innovations and ensure that they scale. We've had a lot of experience over many years in the global health sector with really cool digital health innovations that have come up, and they've stayed at the pilot level. They haven't really ever scaled because there hasn't been the thinking about how to get them to scale. So I think it's crucially important for governments, and I understand that the government of Ethiopia now is really, really focused on doing innovation across the entire government, but within the health sector, thinking about the problems they're trying to solve and which of those problems really could benefit from an innovation, whether a digital one or other kind, and then having a process within the government to bring those innovations in and then work with all of the different layers of the system to ensure that they actually scale and improve health. I think, which are the innovations that will actually work? There's lots of talk about, improving diagnosis with, the AI doctor. I think there probably is some potential for that, but I worry a little bit that becomes kind of like a shiny object that everyone thinks, oh, wow, we'll just all have AI doctors. But that's only one little small piece of this system. Yeah. And so if innovators go off and develop AI doctors, I doubt that without thinking about how that fits into the broader system, I doubt it's going to have a lot of impact. I do think all three of us were talking earlier about the opportunity for AI and new technologies to really help us use the data. Assuming that data exists, I think we need to still be figuring out ways to collect the data so that it can be used by AI models. But using that data to be able to do better resource, directing resources to where they are needed, as Thomas mentioned earlier, and for ministries to really be able to make good decisions, especially recognizing that the world is complex, that disease patterns are changing, that there are going to be shocks, and being able to have the data where you can real time see what is needed and then address that is going to be very important. So I hope that the innovators out there will really think about how do we develop innovations that are going to build that system, and then governments will really support the scale up of innovations that are actually going to lead to more integrated systems that really help in this complex world.
Thank you, Gina. And to you, Thomas, you talked about looking through different portfolios of innovators and trying to identify what will really create impact for children. So speaking to innovators, what would you say, what advice would you have them in terms of what's needed now, today, in this context that will move the needle?
So I want to build on what Gina was saying, because I think it is so important, right? If I think of the future of health, to me there is that system thinking, so the central body of data, and that should inform those decision-making moments on where resources should be directed at, supported and also informed by what happens at the community level. We know that that at this stage, about 85, I'm not a medical doctor, but I think it's about 85% of neonatal under-5 mortality and maternal mortality happens at the rural level. All right, so that is our challenge, is we know that in most of those urban centers, we're doing well as a continent or as a world. So we need to get to the next level. And so the question is, how do we help the government make the right investment decisions that Dr. Mirkuzie was mentioning? Where do these decisions land? How do they land with systems like community health workers, right, that are kind of the first frontier of those health systems, and quite often are left a little bit alone. If I don't want to be too harsh, but I think it's a tough job. Many of them are volunteers. Many of them don't have income. So to me, part of what I would find exciting is, as an innovator, how do I enable those systems at the community level to work and inform central bodies. And so think interoperable data sets, think either open source technology so that we can work with different sets of technology, think scaling from the beginning, so design to scale from the get-go, think transparency of how the algorithm functions so that if an health worker, community health worker who's probably not hugely technically competent should be able to express to a family, I'm giving you that advice, not just because I'm getting on my screen, but because it makes sense. And this is how the technology functions, is going to be hugely important for trust to be built. And we know that trust will define, engagement at those community levels. So think about that trust notion. And also, if you're an innovator, think about, your innovation going to scale. And many of the companies or the innovators, entrepreneurs we speak to are often both incredibly bold, because being an entrepreneur in Africa is tough. Mm-hmm. It's tough anywhere in the world. I think if you are in Africa, it's a whole new level of tough. And yet they quite often don't think somehow bold enough. So when we tell them, all right, it looks amazing, the government we had an example recently, in Mongolia loves what you're doing. We've tested it in 2 regions. They want to take it countrywide. What's the cost? No answer. They're not prepared for that. Mm-hmm. And when they get the cost, then it's completely unaffordable from a system perspective. Because most of these government systems, whether it is about education or health, they have very little fiscal space to operate under.
Yes.
So it's getting your innovation to work at a relatively low cost at scale, and thinking that scaling as part of your business model is part of what I think we really oftentimes struggle with. So back to Gina's point on scale, that affordability versus impact is quite often where we have a blockage.
Thank you very much. I really have enjoyed this conversation, but just to conclude, what I hear you saying is we do need data now more than ever to help us to make the right decisions. And then our governments, our African governments, need to invest more in health. But the good news is that if this data is available, then it helps them to prioritize and to make the right decisions and to know where to funnel the investments. But then not leaving the community behind, because the system exists for communities, and so they must be engaged. And in fact, there are local resources available within communities that we need to think about mobilizing. But coming to your point, Thomas, I really liked what you said, that innovators need to build for the system, to enable the health system as it is, and to support particularly those on the front lines of care. And finally, that they need to build affordably and with a scale mindset from the beginning. So thank you very much, ladies and gentlemen. This has been a wonderful conversation. Please enjoy the rest of the conference. Thank you.
Thank you for having us.
Thank you.
Thank you.